programs as well. Right now, we're looking for ways to reform our entitlement system, which is failing certain beneficiaries who feel stuck in the status quo. An important part of this effort is helping people reenter the workforce. I'm looking forward to hearing from our panel of witnesses today on how we can continue to assist beneficiaries find good paying jobs and regain their financial independence. I also appreciate our witnesses being flexible with the House schedule. We've had to postpone this hearing from a few weeks ago, so thank you for appearing today instead. I now yield to the subcommittee's ranking member, Susan Davis, for her opening remarks.
Thank you, Mr. Chairman. I appreciate your calling this hearing today. As our committee begins to discuss welfare, or specifically work support programs, we must remember that these programs don't serve nameless, faceless numbers. They serve our nation's working class, thousands of American families who are struggling to make ends meet. And we must be willing to help these working families, not kick them as they are down, as they struggle to lift themselves up and find economic security. Unfortunately, this is exactly what the expansion of work requirements would be doing. I'm concerned that when we talk about welfare to work, we are perpetuating an outdated, baseless myth that people who receive benefits are not working. The research shows us that most low-income people on these programs are already working. We must dispel another myth here, the false assumption that getting people into a job will in and of itself lift them out of poverty. Today, we see that the nature of work has changed. Low-income workers face poverty-level wages. The federal minimum wage is $7.25, which is below the national poverty level for a family of 3. Many workers face highly unpredictable, unstable schedules, which dramatically affect their earnings. They earn few to no benefits in their low-wage jobs, and as a result, these working families find themselves increasingly reliant on low-income work support programs because their jobs do not support their basic needs. Programs like SNAP, TANF, and Medicaid actually support working low-income people by helping them put food on the table and access health coverage. But if we expand work requirements to new programs like Medicaid, or expand them within existing programs, they will only make it harder for working families to access this critical help. Analysis after analysis has found that in most cases, work requirements do not increase stable employment. And when there is an increase, it is insignificant and small. Even with work requirements, most recipients remained poor. So we need to have a discussion about how we can better serve our families in poverty. Workforce development services, as we know from past outcomes, play a critical role in helping to successfully move people into better jobs. And yet over the past few decades, there has been a steady decline in investments made to our nation's workforce development. TANF is only serving 23 out of every 100 families in poverty. So we must, and I think we can, do better. We will hear today from state representatives who are working to better integrate their Workforce Innovation and Opportunity Act, WIOA, programs that are like TANF and SNAP. I do believe with better coordination, we can better serve our nation's working families. I am very concerned that all too often, a call to increase coordination simply means consolidating and restricting access to needed benefits. So we see this happening in some states already. Consolidation is leading to fewer families that are actually being served. We have to remember that while TANF, WIOA, SNAP, and Medicaid should work in tandem, and it's great when we see them doing that, they each ultimately serve very different purposes. And the supports these programs provide together are powerful tools for lifting working families out of poverty. But taking away these supports does not help a person get a job, access training, or gain higher wages any faster. So after passing a huge tax cut for Americans' wealthiest 1%, I hope we can have a genuine and a long overdue conversation about how to best help our nation's working class. Thank you all for being here, for joining us this morning, and for providing your insights.
Thank you. Pursuant to Committee Rule 7C, all members will be permitted to submit written statements to be included in the permanent hearing record. And without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous material referenced during the hearing to be submitted for the official hearing record. I would now like to introduce our witnesses for this morning's hearings. First, we have with us from my home state, the Commonwealth of Kentucky, Mr. Adam Meyer is the Deputy Chief of Staff for Policy for our Governor, Kentucky Governor Matt Bevin. Mr. Robert Dorr is a resident fellow in Morgridge, got an extra consonant in there than normal, Morgridge Fellow in Poverty Studies at the American Enterprise Institute. Dr. Heather Hahn is a senior fellow in the Center for Labor, Human Services, and Population at the Urban Institute. And Ms. Liz Carver is the Workforce Development Program and Policy Division Director and TANF Administrator for the Utah Department of Workforce Services. I would now like to ask our witnesses to raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Let the record reflect the witness answered in the true affirmative. Before I recognize you to provide your testimony, let me briefly explain our lighting system. It's pretty simple, but when you begin, the light in front of you will turn green. When there is 1 minute left, the light will turn yellow. When your time is expired, the light will turn red. At that point, I will ask you to wrap up your remarks as best as you are able. Members will each have 5 minutes to ask questions. So I'll recognize first Mr. Meyer, my friend from the Commonwealth of Kentucky, for 5 minutes for an opening statement. You're recognized.
Chairman Guthrie, Ranking Member Davis, and honorable members of this subcommittee, thank you for the opportunity to testify today. Kentucky was recently the first state approved to add a community engagement requirement to its state Medicaid program for non-exempt adults without primary caregiving responsibilities for a dependent. This community engagement requirement is similar to the work, volunteer, and training requirements that exist today in other human service programs. To that end, Kentucky has closely aligned community engagement requirements and the accompanying employment and training programs to what exists today in programs such as SNAP, TANF, as well as workforce programs such as WIOA, but that effort has not been without its challenges. While the approval of Kentucky's 1115 waiver program is groundbreaking and transformational for the Medicaid program specifically, how Kentucky is choosing to operationalize the waiver as part of a comprehensive entitlement and workforce effort reform could help inform the members of this committee as well as Congress in general about the future efforts to undertake similar reforms at the federal level. I would like to offer the members of this committee a high-level overview of some of the challenges we have encountered during our planning for our Section 1115 Medicaid waiver, as well as offer some suggestions that could increase consistency across programs, offer flexibility to states, maximize the effectiveness of taxpayer dollars supporting these programs, and most importantly, streamline compliance requirements and improve outcomes for the individuals we serve. While there are certainly differences in the objectives and focus of the various programs that we are discussing today, the goals of the employment and training programs under the jurisdiction of this committee, for all intents and purposes, are the same: to provide program beneficiaries with the support and tools they need to be on a path of employment and self-sufficiency. There is significant overlap in the processes and components that are used by the states to administer these programs, but where program and funding stream policies differ, program inefficiencies and confusion ensue. These programmatic differences are rarely critical to the success of a particular program. They are merely the result of being developed in operational silos without much consideration for program policies developed in other silos. There are certainly several options available to resolve the issue. For example, one option is for Congress to take the lead in examining the multiple programs that contain an ENT component and decide on common policies across all benefit programs. Another option is for Congress to set guardrails for all the programs and allow states to take the lead in deciding how to normalize the policies within the guardrails set by Congress. Many of the programs administered by states are state-federal partnerships. To states, however, they sometimes feel less like partnerships and more like a subservient relationship. States are left to navigate the administrative complexity of multiple programs. Admittedly, it is not easy to strike a balance between ensuring consistency across federal programs while giving states the flexibility to be most effective. But when it comes to employment and training programs, a one-size-fits-all approach will not be the most successful. States, regions, and local areas all have unique challenges and advantages, and as such are in the best position to exercise judgment on the most effective way to prioritize finite financial and human capital resources. State flexibility could be achieved through several approaches. The easiest would be to increase the types and scopes of waivers for federal requirements. However, this solution would be the most cumbersome and least effective. A better option would be for the federal government to set guardrails by program, but give states the flexibility to work within that framework. This would be similar to the block grant approach used in TANF and CHIP. An even more flexible option would be to allow funding for multiple E&T programs as well as employment support programs such as housing, childcare, transportation subsidies, etc., to all be included in one block grant. Again, Congress could set the parameters, the floors and the ceilings for how much flexibility is granted, but states or grantees could determine the best way to allocate E&T resources as well as the resources for the supportive services that are critical to the success of individuals benefiting from these programs. To increase the success of cross-agency alignment and flexibility, it would be key to establish one coordinating office to ensure that various departments are all committed to the true integration of services. I'd like to touch on privatization of services. Another area where greater flexibility is needed is the ability for state and local partners to leverage a private sector workforce. Many efforts have been undertaken to look at and address the complexity and maze of programs that serve lower-income Americans. Often, these efforts look at funding, policy, or performance measures. However, it is important to also look at service delivery options. Today, states have very different levels of authority to use the people, processes, and technology of contractors to deliver services. For example, states can generally contract out work and training activities in a variety of programs, but the ability to contract eligibility and related services varies greatly in each, as evidenced in the chart I've provided with my testimony. For that reason, I would ask Congress to provide states full flexibility and authority to contract out services for all of these programs. Governors and agencies should have the ability to determine the right mix of state staff and contracted services to effectively and efficiently deliver service and drive performance-based results. This committee should also make efforts to eliminate or mitigate benefits cliffs, as well as make more strategic use of federal funding for information technology systems. I have provided additional information in written testimony in each of these topics. In conclusion, I would like to thank Chairman Guthrie, Ranking Member Davis, and honorable members of this subcommittee for the opportunity to testify. Please know that the Commonwealth of Kentucky stands at the ready to be a resource to the members of this body on this critical issue.
Thank you very much. Appreciate your testimony. And Mr. Dorr, you're recognized for 5 minutes for your
Chairman Guthrie, Ranking Member Davis, and members of the committee, thank you for the opportunity to testify today. My testimony is informed by more than 18 years of working in state and local social services agencies in New York State and New York City. My remarks reflect 3 key points. First, our country's social safety net reduces poverty, but it is most effective when families combine earnings with support. Second, too many individuals receiving government benefits are not working at all. And third, an expectation of work across safety net programs is needed. This should include implementing work requirements. Much of my career has been spent working to provide benefits directly to low-income residents. The first lesson I learned is that our system helps people escape poverty by combining income from earnings with assistance from government. When earnings are leveraged with public benefits, even a low-wage job offers a path out of poverty. A single parent with 2 children who works full-time for $8 an hour can receive $25,000 per year in government assistance when you consider SNAP, tax credits, child support enforcement collections, and Medicaid, bringing their total income well above the poverty line. For these reasons, I believe that our public policies need to prioritize individuals who are receiving aid but not working. I am not referring to the elderly or the disabled. I am referring to working-age people receiving benefits who are not working but likely could be. And contrary to what some believe, the problem of limited or no work among recipients is real and large and needs to be addressed. And now is an especially good time to prioritize this issue. Our economy is as healthy as it has been in quite some time, with strong economic growth and great confidence in what the next few years will bring. While the economy is strong, one problem remains. Labor force participation has not returned to pre-recession levels. From the standpoint of a former administrator of SNAP and Medicaid, what is important is not what the cause of non-work is, but what we can do about it. And here, SNAP and Medicaid are very important because we can turn to those programs to identify individuals who are in need because they have no earnings. Let's first consider SNAP. Estimates suggest that between 9.5 and 11 million SNAP recipients between ages 18 and 59 and not disabled report no earnings when they apply and receive benefits. This means that in the context of a relatively strong economy, millions of SNAP recipients who could work still reported no work. Perhaps this is unsurprising, given that until recently, the primary focus of SNAP was on increasing enrollment, with no emphasis on employment. The only work requirement that exists within SNAP for able-bodied adults without dependent children was waived for the vast majority of states throughout the past decade. And even today, with the national unemployment rate at 4.1%, 8 states still have no work requirement for ABOTs for the entire state, and 28 have no work requirement in at least part of the state. Congress should strengthen work requirements. Contrary to some reports, work requirements do not mean that every SNAP recipient must find a job in the private market. Work requirements could be satisfied by participation in job search, an education training program, workfare, or a subsidized job. At the very least, state and local SNAP agencies should be required to assess the employment status of SNAP recipients reporting no earnings and make employment service referrals where appropriate. And Medicaid presents a similar situation. The Kaiser Family Foundation reported that approximately 9.8 million working age and not disabled Medicaid enrollees reported no earnings in 2016. Similar to SNAP, very little attention has been paid to employment among Medicaid enrollees prior to now. I believe that state and local social service agencies should be required to encourage work among beneficiaries of safety net programs. And during my time as the co-chair of the bipartisan National Hunger Commission, it became clear that there was bipartisan support for this. We unanimously agreed that programs providing government assistance should be required to help people who can work find work. State administrators of Medicaid and SNAP have been too often discouraged by the federal government to believe that helping participants with employment is not their job. This attitude is harmful to the very people these programs intend to help. A work expectation with reasonable consequences if the expectation is not met should also be applied to individuals receiving benefits. During my time in New York, I found that aggressive efforts to connect people to work can lead to gains in employment, reductions in dependency, and declines in poverty. This might involve reducing or terminating benefits if a recipient declines to participate in a reasonably scheduled activity or fails to accept and offer employment. States need to identify non-working recipients as an important subset of the SNAP and Medicaid population. They should list them by zip code and develop a plan for staff to engage them in a conversation about work, including that their failure to use their benefits to supplement earnings was keeping them in poverty. The social safety net in this country serves an important purpose. Research shows that it reduces poverty and has positive impacts on child and adult well-being. But we have a responsibility to ensure that employment remains the primary way families support themselves, and that government programs do not impede this goal. Congress can take concrete steps to achieve this. Doing so will lead to increased earnings, reductions in poverty, healthier families, and stronger communities. Thank you.
Thank you for your testimony, and Dr. Hahn, you're recognized for 5 minutes for your testimony.
Chairman Guthrie, Ranking Member Davis, and honorable members of the subcommittee, thank you for the opportunity to share insights from my research on supports for low-income children and families. The views I express are my own and should not be attributed to the Urban Institute, its board, or its funders. I've spent 2 decades researching how TANF and similar supports for low-income families work in practice. I've listened to frontline caseworkers and state program administrators, and I've listened to parents across the country who are participating in SNAP, Medicaid, and TANF. I can tell you there is a strong culture of work among people receiving these supports. I consistently and clearly hear parents say they want to work, to be self-sufficient, and to leave TANF. A mother in Michigan said, "I would give anything and trade all the TANF I could ever get for a stable job." Other women in the discussion said, "Amen to that," and absolutely. Most working-age adults on Medicaid and SNAP who are not disabled are already working. They're using the programs to supplement low incomes and maintain their health and well-being for themselves and their children. And all 3 programs support people who are between jobs. Research from Minnesota found 80% of applicants turned to TANF because they had recently left or lost a job. SNAP is similar. TANF acts as a form of unemployment insurance for people in low-wage or part-time jobs that have increasingly unstable and unpredictable hours and no formal unemployment insurance. For example, in hotels, restaurants, retail, and healthcare. Low-income parents have genuine incentives to find jobs. What they need is access to skill development, training, employment services, and other supports. Given recent interest in both work requirements and alignment among Medicaid, SNAP, TANF, and workforce development programs, 2 evidence-based insights are important. 1, aligning programs, in theory, seeks to improve program access and efficiency. But if alignment cuts funding and reduces services for low-income families, then it could reduce program access and undermine the goal of self-sufficiency. 2, Work requirements, in theory, seek to ensure that people aren't avoiding employment. But research shows that TANF work requirements don't necessarily help people find jobs, and certainly not jobs that lift them out of poverty. Further, the red tape associated with work requirements can cause people to lose access to vital supports even when they are working or should be exempt. Let me share some of the evidence behind these insights. Texas has more fully aligned TANF and SNAP with WIOA than any other state. But this has meant that for every 100 families in Texas living in poverty, only 5 access TANF. Nationally, TANF reaches less than 1/4 of families in poverty, down from 2/3 in 1996. The bipartisan framework Congress developed in WIOA set the stage to improve people's access to valuable services that can help them find work, keep jobs, and increase wages. Ironically, one of the greatest barriers to accessing WIOA opportunities has been TANF's work requirements, which hold states accountable not for getting people into jobs, but for ensuring that people are engaged in a limited set of work activities for a minimum number of hours. These requirements create a counting exercise, not a focus on achieving self-sufficiency through education, training, and other supports. TANF administrators have told me they feel pressured to push some people to work before they're ready, rather than helping them access the supports that could help them achieve long-term self-sufficiency. Many receiving TANF have different needs than those served by WIOA. One TANF administrator said, "We have to look at some of these folks needing time for treatment, physical therapy, surgeries, and mental health treatment." Plus, work requirements create administrative processes that are cumbersome and affect both the people eligible for assistance and the government agencies providing it. We've seen in Medicaid and SNAP that even without work requirements, eligible people lose access to health care and food for procedural reasons, like not completing paperwork on time or office errors. In conclusion, people with few employable skills could benefit from expanded access to workforce development programs, and low-wage workers could benefit from more efficient access to SNAP and Medicaid. But we still need basic cash assistance when people are unable to work full-time, year-round, earning living wages. And expanding work requirements for SNAP and Medicaid without new funding for workforce development or subsidized employment could undermine the employment and skill development goals of the workforce development system while denying basic health care and food to adults and children who need it. I'd like to leave you with a quote from a couple in California who was working and going to school while receiving TANF for themselves and their children. They said, "Right now, we are struggling and having it hard. We are trying just as hard as you are. Don't give up on us. We are utilizing this program to get us to the next step." Thank you. I look forward to your questions.
Thank you. I appreciate your testimony. Ms. Carver, you're now recognized for 5 minutes for your testimony.
Good morning. Thank you, Chairman Guthrie, Ranking Member Davis, and members of the subcommittee. I'm honored to be here representing the state of Utah, our governor and executive director. It's fitting that our state was asked to provide input on our work-first approach. After all, Utah's nickname is the Beehive State. The Beehive stands as a symbol of hard work and industry. More than 20 years ago, Governor Michael Leavitt and Lieutenant Governor Oline Walker organized a task force to evaluate Utah's workforce and welfare programs. We had more than 29 programs spread out between 5 state agencies. Quoting Governor Leavitt, he said, "It just cried out for a better solution." The task force ultimately created one department comprised of workforce and welfare programs with the intent to provide better services to Utah citizens. Today, the department manages the following: workforce development, unemployment insurance, welfare, vocational rehabilitation, child care, veterans employment, refugee services, housing and community development, and labor market information. We believe this model works well in good times and bad. We've been fortunate to experience 48 consecutive months of less than 4% unemployment. We know this model assists Utahns in getting their first job, finding a better job, and getting a fulfilling career. Each of these programs benefit from operating under a unified single state agency with one leadership structure, streamlined service delivery, braided funding sources, integrated technology solutions, and a single established brand. When the decision was made to bring all the workforce and welfare programs together, the state made a few important commitments. First, the commitment to exceptional customer service. By bringing these programs together, we created a one-stop system with one website and a common entrance to receive services that would otherwise send citizens to multiple locations. Second, the commitment to technology. Utah has a strong online platform to ensure that customers can access services through multiple options at their convenience. Third, the commitment to being family-focused. This includes Utah's Intergenerational Poverty Initiative to fully understand the cycles of poverty from one generation to another. To further illustrate how an integrated model allows Utah to be work-first driven, let me share an example. We've been able to leverage our workforce expertise with TANF recipients to engage in pilot programs resulting in soft skill development, credential attainment, and employment obtained. We started with a program for single mothers in poverty and plan to build upon our success with an upcoming project to assist absent fathers in obtaining employment and re-engaging with their children. Let me end by addressing work requirements and activities taking place in Utah. Because work first is a priority and our programs are aligned, this principle is no longer something we just believe in. It is a standard practice. When someone needs to apply for SNAP or Medicaid, they do it through an online portal on jobs.utah.gov, where job-seeking services are readily available. When someone needs face-to-face service for public assistance or are likely to exhaust unemployment insurance benefits, they come into one location, an American Job Center, where employers are on-site recruiting for available jobs. When a TANF customer needs child care support to obtain and maintain employment, we are quickly able to assist in removing barriers because our programs work together. First, I would like to leave you with some recommendations to consider. First, we recommend outcome-based measures instead of focusing on activity and programs. For example, measuring skills gained, credentials attained, and employment secured. Second, continue to push integration at the federal level. Even though we integrated 20+ years ago, it took years of research, coordination, and a governor leading the charge to make the change. If it is siloed at the federal level, it will likely remain siloed at the state level. Third, allow individuals to access education that leads to recognized credential as an option under work requirements. Fourth, align work requirements across programs and give states the flexibility to implement. Finally, we regularly host other states interested in our model who ask questions about where to begin or how to replicate. Through our labor of love over the past 20+ years, the feedback we offer is that it's not one single thing. Merely having a single leadership structure or program co-location will not necessarily duplicate our results. We have observed the need for a total package of leadership, culture, technology, braided funding, and a commitment to serving fellow citizens. Thank you.
Thank you for your testimony. I appreciate that. We're now moving into the part of the hearing where members will have opportunity to ask questions. We're all going to be recognized for 5 minutes to ask questions. I don't see the chairwoman here, so I will recognize myself to begin the questioning. Recognize myself for 5 minutes. Dr. Hahn, I really appreciate your testimony and the stories, the anecdotes, or the stories that you talked about. The lady said, I think in Michigan, that if she could trade all of her TANF, if she could get a good paying job, and then talked about how TANF seems to block, or the red tape around TANF prevents people from accessing the Workforce Investment and Opportunity Act, which we did pass here bipartisan. So we need to, that's what we're here to try to figure out. So that's why these hearings are important in the testimony and move forward. Talk about Kentucky, we have Mr. Meyer with us here today. Kentucky expanded Medicaid on the governor's signature, the previous governor's signature, and when our current governor was elected, there was a lot of pressure on him to undo the expansion of Medicaid. And so if we were sitting here today looking at entitlement reform merely as a budget number and trying to make a budget work and not concerned about beneficiaries and what happens to them, he could have easily done that. That was just on his signature the way that it's set up back home. But he didn't do that. And so what he wanted to do, if he said, so Kentucky has 1 million people. We have 4.5 million residents. Almost 25% of our Commonwealth is on Medicaid. And it's just straining on budgets. So there is a budget concern, but he could have solved that with one signature. So what he decided to do, if you really look at what they're doing, and he's been criticized from some different folks for it, is how do we have a transition period for people to work themselves off of it? That's what he wanted to move forward. And how do we treat it more like insurance? Because when people go from Medicaid into a workforce and hopefully work themselves onto jobs with benefits, they're going to have insurance. So let's have a premium. And premiums are from $0 to $15, if I remember, is the highest premium you could pay if you're on that. And then 20 hours of work. So that's what it is. And it's, Because if you were single with children, if you were elderly, if you're disabled, you were already covered by traditional Medicaid. So the focus is on, I think it's 66,000 people that are in the able-bodied category. And Paul Ryan, when we first started talking about tackling entitlement reform, and you think about it, said the biggest tax rate in America today is on the single mom making somewhere in the 20,000s who improves herself, and it's an 80% tax for them to move up because they lose the benefits. And so I think that's what Dr. Hahn was saying, and what others are saying. How do we, currently our benefits, a lot of them are cliffs. You earn a penny more than that, then all of a sudden you lose this. And so if you're the family in Michigan on TANF, if you're on Medicaid, if you're a single mom with children on Medicaid, and going to work even with a job with good wages and benefits, but most of them are going to have some kind of premium, some kind of deductible, and all of a sudden you got to make a decision. I'm going to be better off 5 years from now, but my kids got to go to the doctor next month. And so we really, this is really what we're trying to get at. And then, Dr. On, your testimony really kind of hit at what, to me, because the issues that you brought up are what we're trying to, how do we move this forward? And I'm on energy and commerce as well. Instead of getting to questions, I guess I'm talking a lot. But somebody held up a newspaper that said Kentucky's welfare work requirement is going to cost more money. It's going to cost the Commonwealth more money. But it is in the short run, if they didn't read the article, just the headline, because exactly what Dr. Hahn said, Kentucky's investing money into a system to help people transition off. So they're spending more money up front to take care of the benefits. So if you talk about, Mr. Meyer, that just where they're saying it's going to cost more money, but what you're actually doing to try to get to the transition, I'll just be quiet and let you speak for the next minute and a half.
Sure, yeah. So thank you, Chairman Guthrie. The implementation is going on right now. So of course we're spending money right now to implement the waiver. That doesn't start until July 1st. So certainly it is going to cost money up front. But because Kentucky Health is a comprehensive program that is holistic and looks at all the social determinants as well, and we're integrating and breaking down those silos, the investment we're making is across the board in technology. So it's not only for Medicaid, it's also for our employment and training. So we've taken from the human service programs, at least from SNAP starting out in January, and then from Medicaid starting in July, the community engagement, employment and training component, and we've moved that to our local workforce development boards. And this allows them to focus on what they're good at. It allows us to keep eligibility separate, but it allows the state to update and streamline an IT infrastructure that was highly lacking when we came in. We were using spreadsheets. It was disjointed. There was a hodgepodge of different programs for employment and training across the state. And so we're going to have one streamlined solution, and that's really what we're investing in right now. That, and as well as the ability to have comprehensive data and analytical capabilities. So we're in the process of establishing governance agreements between our Education and Workforce Cabinet, our Cabinet for Health and Family Services, so we can share that data and truly understand the effects of the waiver, as well as all other policy decisions we're making, and how those employment and training components can relate to the claims data, for example, that are in our Medicaid programs, so that we can get a better picture view. Yeah, my time's expired, but just so the governor and the administration is trying to combine these programs together, something that was brought up by some of the research. I'm looking forward to reading, Dr. Hahn, your research. I look forward to looking at that. But I've run out of time, so I'm going to recognize Congresswoman Davis for 5 minutes to questions.
Thank you, Mr. Chairman, and I appreciate, again, all of you being here, and I know we're going to hear some differences of opinion, and that helps in some ways to clarify. I think we're all looking for that. Dr. Hahn, I think some of the witnesses, as you know, assert that the most important thing for families receiving SNAP, TANF, or Medicaid is to encourage a culture of work. And Mr. Dorr, you suggested that there are too many families receiving government benefits who are not working at all. Where do we come together on this then? Are there too many families that are receiving assistance that are just not working at all? I think you suggested that, in fact, the majority of them are working, and or they want to work. So
I don't. There are too many. It's 9 million who report no earnings. When you I took applications in SNAP and Medicaid. You can't determine eligibility unless you know how much they're making, and if they say zero. My view is the program should say, okay, we want to give you Medicaid and SNAP for now, but these programs don't work successfully.
Mr. Dorr, when you're
unless they're working too.
Sure.
So there's a big group of working people, that's true, But there's also a big group of non-working people, and those folks are really in need. And these programs are saying, here's your card, I'll see you in a year.
I think one of the questions, and it's difficult, I think, right in the setting, but is that there are people who are getting those benefits or seeking those benefits, but in many cases they're between jobs. So that when they're being asked, are you working? No, they're not working, and the reason that they're trying to get benefits is because, in fact, they're not working. So I think, Dr. Hahn, through your research and work, is that sort of more to the reality for people, that this is an interim time for them, and that the push, which is a good one to try and help them find work, is also based on having a workforce development infrastructure within the community that allows them to do that, rather than finding the easiest job, which in fact doesn't really move them out of their situation. How do you see that working?
Yeah, so I think it's really important to consider the different groups of people who are receiving these types of assistance. And as you say, 80% of the people who are receiving TANF, SNAP, and Medicaid, I think we should consider as low-wage workers. They're either between jobs or are still currently working. There are others who are not disabled enough to qualify for SSDI or SSI. But we have data on that group of people who are not disabled enough to qualify for the disability programs and are not working. And what we see there is that a significant share of those people have illnesses or disabilities or conditions that make it challenging to work full-time year-round. And those people do need supports, and they may be able to, if they have access to specific workforce development and training programs, they may be able to work somewhat, even if they're not able to work full-time. But another issue with the people who are in this group that are not working we need to look at, we have some data on people who are in the Kentucky Medicaid program. And there are 188,000 enrollees who are in that group. They're not disabled enough to qualify for disability. They're not working. And over 61% of those reported a serious health limitation or living with someone who does, which limits the scope of activities they can do. So requiring them to work and then taking away their health care if they can't work is not going to help them get those jobs. There may be things that we can do to help them work somewhat, but taking away their health care is not going to work when it's the health care in the first place that is preventing them from working.
In the short time I have, please excuse me, I wanted to just go to Mr. Meyer then as we're talking about the Medicaid situation and the problem that you were trying to solve or address in Kentucky, because when the vast majority of Medicaid recipients are already working, which seems to be what we've seen, I'm then wondering why you're going through all the trouble of developing onerous community engagement requirements if, in fact, most of them are working. So what is the goal? How do we use Medicaid then to try and place them in jobs if, in fact, they're working or they're having the kind of schedules that really would not allow them to get benefits and still be working? How do we square that?
I do see I'm out of time. I briefly answer
With indulgence of the committee, I'll give you half a minute to answer.
Yeah, so we've actually looked at the data from the Urban Institute and compared it to our own, and I know that was based on, I think, self-reported data or census data, and we've compared that with our actual eligibility data and cross-referenced it with our labor and wage data within our Center for Education and Workforce Statistics, and we're not seeing the same type of numbers. So, we actually see out of the 500,000 people that are enrolled in Kentucky Health that there's about 189,000 after you exempt for single parents, pregnant, SSI, SNAP, TANF, 10% medically frail assumption. We see there's about 189,000, and so when you take that are still not working 80 hours a week. And so when you take that into account, that's still a lot of people. And when we have a third of our population in Kentucky enrolled in Medicaid, it's important that we provide the right incentives, but also the right supports. And so, yes, we do have the support network. We're building that out even more, but we need to make sure we have the incentive to get people to those resources so that they can get to a job, a better job, and then to a career.
We're going to get to more of this as we move forward, because I probably need to move on. But just to point out that Congresswoman Davis's heart's in Kentucky, right? Her husband's from Louisville, so we appreciate that. I'd like to recognize Congressman Mitchell for 5 minutes for questions.
Thank you very much, Mr. Chair. Dr. Hahn, I'm a little confused. You could help me with something real quickly. Your testimony is on letterhead from Urban Institute. You indicate that the views are your own. My experience here in 16 months is that, frankly, the transparently understanding the political influences that people bring as witnesses to the table are helpful. Who were the key supporters or sponsors of the Urban Institute, please? Thank you.
I can submit that for the record.
You can't give me an example for the hearing?
My understanding is about half of our research is funded through federal contracts, and the other half, it's not exactly half, the other half is through a wide range of foundations.
I would like that if we could, and I'd like to have this submitted in the record if I could, Mr. Chair.
Without objection.
For background information, Dr. Hahn, I operated some of the largest welfare work programs in the country and operated workforce programs under CETA, JTPA, WIA in cities like Detroit, Grand Rapids, Cleveland, Savannah, Mobile, Grand Rapids, including the welfare work program. So you and I have very different experiences. My experiences are operational. We're the lead contractor in the city of Detroit with 28 subcontractors for welfare to work. I think your concern is one that what the performance standards are relative to the validity or usefulness of work. I agree that having a standard that says that if you don't meet this participation requirement does not help get people to work, but I think you need to separate out the two items. Someone working is a positive thing, and my experience operating these programs with thousands of recipients, we ought to score that, we ought to rank that at performance standards as a positive outcome and give credit to that. But I think as you look at it, and I would appreciate in your testimony as you think about this going forward, separate out how we assess performance of an agency and the outcome and whether we have work requirements and the outcomes for the individual. Because a lot of your testimony here is about process. We can fix the process, but I think we need to step back from the expectation that work is somehow onerous and negative for family. And I would ask that you look at that because I think it's a significant problem.
I agree with you that work is valuable and that families want to work. And so, but a work requirement does not help families access jobs and jobs that lead them out of poverty.
You and I have a fundamental disagreement. Let me give you an example. You talk about low-wage workers and they're being stuck in low-wage options. The reality is, with training and support, having the right set of income support programs so there's not a cliff, as was mentioned by the chair. In fact, we can move people from those. We need to have an expectation we do that, otherwise people get stuck in them. You've talked about people being stuck in them, yet somehow we want to continue to enable that, rather than say, we need to move you forward. And I would challenge directly, and happy to have the debate with you on a more extended basis than we have available here, but you need to separate out where they're at now and what we can do to help them, rather than say they're all bad and we shouldn't have a work requirement. The other challenge I'd make for you is, you talk about forcing people to work. We're talking about 20 hours in a week. You have to explain to me how it is we can't possibly get the majority of people that are needing assistance, that are currently on assistance and are living there in extended periods of time. We can't help them go to work 20 hours a week or go to training to prepare for, as you put it, independent living or be financially self-sufficient. How is that?
Well, let's look at Kentucky in particular, because Kentucky, look at the proposed Kentucky work requirements under Medicaid. And so if you look at people who say they are working in the American Community Survey, they are workers, but they are not working at least 50 weeks a year and 20 hours a week. So they would not meet Kentucky's work requirement consistently.
Let me stop you. I understand what you're saying, at least conceptually, but the reality is as Mr. Meyer said, your data and Kentucky's data, they appear to be in the same wavelength. So if you want to come up with data that actually matches what the agency has and not your own cut on those, that'd be great, really helpful.
I think we had the same number. I had 188,000. I think he said 190,000.
Let me shift to one other item you talk about, which is the people between jobs. I would suggest to you that having a work requirement having assistance to move to work, having support, even if we have to change our income support programs, we ought to have the work requirement in order to expedite the return to work. Return to work that is hopefully better than the work they lost. But the reality is I don't see where the work requirement somehow is an impediment to doing that. Rather, I see it as a positive. So where's the impediment?
As I said, my experience looking at work requirements in TANF is that it really is a counting exercise, counting how many people are in which activities for which hours, and that it's really not having a focus on what someone needs to have a job that will lead them to self-sufficiency.
Because that's because of the performance standard and not whether or not the program is useful to have. And we're back to the same question I challenged you with earlier, and I would challenge you to look at your research. Separate the performance standards, which may well need to be changed, to the reality of does work help the individual, the family, and frankly our economy move forward. If it does, we need to focus on that, even if they change the performance standards and or the program. But we can't conflate the two and say, therefore, work requirements are bad.
No, I agree that work is important, and I think work requirements are not the way to get there.
You and I have a fundamental disagreement, but I yield back. Thank you, Mr. Chair.
Thanks. And since we've gone over on this one too twice, so I'm going to get back to the 5 minutes if we can do that. We've done both sides over a little bit, so that's Congresswoman Adams, you're recognized for 5 minutes for questions.
Thank you, Mr. Chairman, and thanking ranking member for convening today's hearing, and for the witnesses. I want to thank you as well for your testimony. And Mr. Chair, I want to enter into the record a letter from the Network Lobbying for Catholic Social Justice that speak to the issue that we're discussing.
Without objections, order.
All right, thank you very much. Let me bring some facts to this discussion, and I hope I can shed some light on how those on Medicaid in particular already are working, do not need the so-called reforms to the program that states like Kentucky are proposing. 60% of adults on Medicaid are working, and nearly 80% are in working families. And of those not working, more than half are family caregivers in schools and already looking for work. And to be more specific, 60% of Medicaid beneficiaries are working, and of the non-working adult Medicaid recipients, 14% are ill or disabled, 12% are providing care to loved ones, 6% are going to school, 4% are retired, and 2% couldn't find work. Mr. Mayor, can you explain the justification for Kentucky's waiver, and how does it exactly assist in promoting the objectives of Medicaid as required by the Social Security Act? I personally don't see how making low-income people submit a lot of paperwork to prove to you that they're working proves healthy outcomes. So if you could speak to that, appreciate it.
Certainly. So there's a plethora of research out there that shows a direct link between health outcomes and people who are engaged in work, volunteer, or community activities. So we wanted to take a holistic view that focused on the entire person that's in the Medicaid program, and make sure that we give them supports that are needed to address not only access to health care, but also changing behavior that allows for more healthy behaviors, also to things that can help their upward mobility when it comes to their social impediments that they have, whether it's a barrier with childcare or transportation. We want to make sure that we're giving them the incentives and the supports that they need to be successful and have the opportunity. So, and I think with as far as Medicaid's concerned and why we're doing this, if you look not only at the people who are not working, but the people who are maybe underemployed, we've provided also the My Rewards account, which provides incentives for not only healthy behaviors, but also being engaged with our career centers and the job and training opportunities. So again, this is all about the ABCs of workforce, a job, a better job, and a career. And we want to make sure we're not only getting the people who are currently not working engaged in that workforce, but the people who are working but maybe want more chance at upward mobility, the opportunity to know what else is out there and be provided those supports and tools that our career centers can offer them.
So let me just add here that Kentucky's own estimates find that you have about 95,000 people who would lose coverage over the 5-year period of the waiver, a 15% drop in total Medicaid enrollment by the 5th year. Are you all comfortable with that?
So let me clarify what that is. That was for a budget neutrality projection, and that is basically projecting that there will be 95,000 fewer people enrolled in the Medicaid program by year 5. So that includes a large number of that population who will actually be moving out of Medicaid and onto private market coverage.
Thank
So
you.
yes, we're very comfortable with having people move from Medicaid to private market coverage.
Okay. Ms. Hahn, there's a strong desire among many in the majority to modify programs like SNAP and Medicaid, similarly to how aid to families with dependent children has modified to TANF. So can you explain how TANF, whose primary mission is to help pull families out of poverty into self-dependence, actually misses the mark?
So we have a lot of experience with looking at the history of the block granting in TANF. And one thing that has happened since TANF was block granted is the size of that block grant has not changed it's been the same amount, which means when you consider inflation, the size of that block grant has shrunk. So states have less money to work with. But it has also meant less access for low-income families who are seeking assistance from TANF. When TANF was implemented, 2/3 of families living in poverty could access TANF. Now it's less than a quarter. And as I said in my opening remarks, when alignment in theory is about improving efficiency and access, but if alignment means cutting funding and cutting supports, then it's going to undermine the goals of access and the goals of self-sufficiency.
Thank you very much, Mr. Chair. I yield back.
I appreciate it. I'm absorbed in the conversation, and I'll losing the clock as well, so it means it's a good hearing. So I will now recognize our chairwoman, Dr. Fox, for 5 minutes for questions.
Thank you, Mr. Chairman. I want to thank our witnesses for being here. I apologize for not being here at the beginning, but I was in a markup for my own legislation, so it's a little hard sometimes, I found, to be in two places at the same time. But thank you all for coming. Mrs. Carver, I strongly believe that Congress has a responsibility to the American people to promote accountability at every level of government. And your testimony highlighted how the inclusion of work requirements in welfare programs can hold both individuals and state governments accountable. As Congress works to overhaul our fractured welfare system, how would you recommend we measure state success in engaging beneficiaries in work and beneficiaries' participation in work?
Thank you for the question. There's a tournament that's going to kick off here shortly that you may be aware of, the NCAA tournament that I'm a big fan of. And as a college athlete, when I played, what mattered was wins. No one cared if I made a basket during practice. No one kept track of my stats during practice. What we cared about was wins. And I think wins for these individuals are credentials obtained, completing education and getting a recognized credential, obtaining employment, increased wages. We've heard a lot about low wages, so increased wages. Those are wins. I think along the way you can count wins of skill obtainment. I think aligning those things that we've learned under WIOA are successful would be really helpful under some of the other programs as well.
Thank you. Ms. Carver, we've held a series of hearings examining the opioid epidemic and have heard from service providers about the benefits of engaging individuals who are in recovery with work and workforce development activities. How would including individuals in addiction recovery programs among those with, quote, barriers to employment, end quote, in the Workforce Innovation Opportunity Act help you respond to the epidemic?
The epidemic is something that impacts all of us in rural and urban communities, and I think that adding this as a barrier under the WIOA barriers would be very beneficial. Utah is currently involved in a very extensive project helping our homeless population navigate through homelessness and into employment and into housing. And through that, we've helped a number of individuals who are in addiction recovery, and I think adding that under WIOA would add an additional tool for us to use. I think as we help these individuals engage in meaningful employment where they can feel successful, that is one tool to help individuals with sobriety.
Thank you very much. Mr. Dorr, in your testimony, you described the approach you believe most effective at engaging a beneficiary in work at a personal level. How would you evaluate success or failure at the staff level under this scenario?
Well, at the staff level, if a Medicaid or a SNAP worker had a caseload, I would be wanting to know what percentage of their work-able population, individuals, report no earnings. And if it was a lot, that would be not good. And if it was a few, that would mean that they were making progress in helping people move into employment. The key ingredient to make these programs work is to leverage some earnings with benefits to bring people above the poverty line.
Thank you very much. Mr. Chairman, I yield back.
Thank the gentlelady for yielding back. I now recognize Congresswoman Blunt Rochester for 5 minutes for questions.
Thank you, Mr. Chairman, and thank you to the panel. I also want to share that I've had some experience in this field as well, serving in Delaware as our Deputy Secretary of Health and Social Services prior to welfare reform and through welfare reform, then Secretary of Labor in Delaware when WEA was established, and then after WEA, I also worked for a think tank that focused on individuals with disability and was there during the implementation of WEOA. So I know these areas somewhat well, and started off as a caseworker in a congressional office about 30 years ago, helping individuals who were trying to get Social Security disability. And so the first comment that I will make is that I think, Mr. Doerr, you said that the cause of non-work is not important, but what we do about it. I do think what we do about it is important, but I do think we need to discuss the causes. Ms. Adams started talking about breaking out more specifically the populations that we're talking about. One of my big concerns right now, having been in the cultures and in the trenches of trying to implement these things, is that we not make assumptions. And so I really want to talk a little bit, and I'll ask Dr. Hahn if you could talk about the policies that you think Congress should consider to address poverty and low-wage work in a more holistic manner. And from there, also, not just adding work requirements, but, the income supports. And the rest of the panel can think on that question as well, but it's first directed to Dr. Hahn about a more holistic approach dealing with some root causes. That's, to me, more important than every agency in the world trying to do job creation and work requirements. I don't think that's the answer. So, Dr. Hahn.
So I think you are right. We do need to take a holistic approach, and a holistic approach at looking at what the causes are. These are complex issues, and understanding the complexity of the causes can help us understand the complexity of the solutions. So many people seem to think that getting a job is the end of the story. And we know that is not the end of the story. Almost 1 in every 8 workers is in an occupation whose median wages barely lift their families out of poverty. These are retail salespeople, cashiers, food service workers, wait staff, stock clerks, personal care aides. And many low-wage jobs in the current economy are also temporary or involve unpredictable, fluctuating schedules with few benefits. So that even when people want to work full-time to support their families, the nature of work is such that that is an impediment. We also need to think about the comprehensive, holistic person and the challenges that they bring. There was a joint paper in 2014 by the U.S. Departments of Labor, Commerce, Education, and Health and Human Services that was focused on the evidence for helping low-skilled workers in the labor market. And they also concluded that there's a need for comprehensive and integrated strategies, and that doing so inevitably requires coordination and collaboration across the systems to really think about holistically what people need. So again, just simply saying you are required to go to work does not help the person have what they need to go to work, and does not recognize the nature of the workforce in which they are involved.
Thank you. I also had a question more specifically about Kansas. People talk about the work requirements in Kansas. They point to that as a success, claiming that just that alone has helped TANF families work their way off of government assistance and build better lives. Are families in Kansas who saw their cash assistance taken away earning enough to lift themselves out of poverty? Can you talk a little bit about that?
Yeah, no, they are not. Similarly, as we saw at the time that TANF was implemented, there is recent evidence from the experiences of families in Kansas who left TANF between 2011 and 2015. And what we saw there is that although most families did work at some point while they were receiving TANF or after, their employment was unsteady and it did not lift them out of poverty.
I'm going to close very quickly because I only have 18 seconds left. Just saying that, again, I want us to be careful about unintended consequences. I was around for welfare reform. The economy was great. It was a great time, 2-year bump for people, and then 5 years looking longitudinally, it was not as successful as we thought. So we just need to be careful. I yield back.
Thank you for yielding back. The chair recognizes Congressman Lewis for 5 minutes for questions.
Thank you, Mr. Chairman. You know, when you talk about solutions, it's always easy to kind of shoot them down or find the problems, but you've got to first decide why you're moving in one direction and look at the status quo. So, Dr. Hahn, I want to do that a little bit with what the status quo really looks like in America today and over the last, the last few decades since the war on poverty started in 1965. And see how anyone can look at this and defend it. The purpose of a safety net, the purpose of public assistance is to move people from dependence to independence. And yet if you look at in means-tested welfare spending dollars, 2012 dollars, it's gone up to $1 trillion a year from about $100 billion at the advent of the war on poverty, the Great Society. And yet look at the poverty rate, the official poverty rate. It was actually declining before the war on poverty began, and it has flatlined as the total means-tested welfare spending has risen. Now, in my mind, you can make the argument it's certainly beneficial so people don't fall through the cracks and starve. That's certainly a compassionate view and one we all agree on. But is it moving people to independence? It looks more like we are subsidizing dependence here. How do you respond to that?
I think there we again need to look back at the nature of work and the fact that when someone is working, they are still not earning enough to support their families, either because, as I said, the wages are low and they're not lifting them out of much above poverty, or that they are not able to find the work full-time year-round because of the temporary and unpredictable nature of work. I think what we do know is that SNAP and Medicaid, the Earned Income Tax Credit, child tax credit, help people, lift people out of poverty. And
well, I'm glad you brought up the Earned Income Tax Credit. That was a very bipartisan push during the Reagan era, and indeed, most people agree it's a good idea. Even if you don't earn enough money, a refundable credit will make up the difference, but it is based on you working. What we're experimenting with here, or what we're proposing here, how is that any different, or aren't you a fan of the Earned Income Tax Credit?
I am a fan of the Earned Income Tax Credit, and I think it has made a great difference, and I think it is a really important work incentive. That's the kind of work incentive that we need, not work requirements. But there are times—
Well, you can't get the Earned Income Tax Credit if you don't work.
There are times when people are between jobs. And in those times, if we do not let people access food and health care, they're going to have a much harder time getting back into a job and reaching that Earned Income Tax Credit.
Thank you, Dr. Han. Let's go to— I'll get to you in a second. Just hang tight. Mr. Meyer, I want to talk about Medicaid for a second. Again, the status quo. We had a massive expansion under the Affordable Care Act in my home state of Minnesota. 220,000 more were added to the Medicaid rolls, many of them able-bodied adults without dependents. However, the healthcare situation in my home state under the Affordable Care Act isn't looking too good. Back-to-back massive increases in premiums. Another 116,000 lost their plans in the last 2 years, brings it to 350,000. Now you move those people to Medicaid, and it is an unsustainable cost on a number of states, including my own and many others, and certainly the federal government. What is the goal of Kentucky's experiment here? Is it indeed moving people to independence, or is it also to reduce the cost of Medicaid, which is unsustainable as the fastest growing entitlement in Washington?
Yeah, I mean, the primary goal is to increase health outcomes and improve health outcomes. But we can do that through understanding that the social determinants have an effect on those health outcomes, and that a key to that is getting people engaged in their own health, their own communities, their own work, their own job training, so that they can move on to a better path and then move off the program. And so in the end, cost savings is certainly a goal, but we think we'll get there by improving health outcomes and getting people engaged in their own health, their own outcomes, and into the workforce.
Finally, Mr. Dorr, let's talk about the economy at large. We've got 125,000 jobs that go unfilled in my home state right now. Can't find people to work. Unemployment rate's record low, 3%. And yet, 41% of the people on Medicaid, able-bodied, have no earnings, are not working. You've got the same situation with SNAP, the same situation with SSI. Who's going to do the jobs? How do we get these people back in the workforce? Because the economy can't grow without an increase in labor and productivity.
I believe that people are staying on the sidelines partly because their non-work is financed by a collection of benefits like Medicaid and SNAP. And we need programs that are serving those people to find ways to engage them in activities that will lead them to work. And they've been told for 10 years, no, don't do that. Your only job is to enroll people. And that's keeping people out of the labor market.
Thank you. I yield back.
Gentleman yields back. Next recognized is Congressman Espaillat from New York for 5 minutes for questions.
Thank you, Mr. Chairman. I would like to ask unanimous consent to enter into the record a release published op-ed by Shelley Academy, the Executive Director of Workforce Tulsa, entitled "Taking Away Health Coverage is No Way to Strengthen Oklahoma's Workforce."
Without objections, ordered.
Thank you, Mr. Chairman. My first question will go to Ms. Hahn, and is how could placing additional administrative requirements on Latino Medicaid enrollees make it more difficult for Latinos to attain and maintain their health coverage? Is there any data or research done on this particular part of the population?
I can't speak to the Latino population in particular, but for all people who are seeking SNAP and Medicaid, there are burdensome administrative procedures that affect both the people who are eligible for assistance and the state agencies that are providing it. So we have seen in Medicaid and SNAP, even without considering work requirements, that eligible people lose access to basic health care and food for administrative reasons, like not completing paperwork and office errors.
And how would increasing the SNAP's already robust work requirements program exacerbates the rate of food insecurity and poverty among all people, particularly those that have been traditionally disenfranchised?
So as I said, even without the work requirements, people lose access for procedural reasons. And work requirements would largely be another administrative process. Mm-hmm. And so adding that workload would be likely to create more people falling through the cracks for procedural reasons.
Is there a projected number of folks, a decrease in enrollment if these work requirements were to be implemented?
Well, I think Kentucky had some data on how many people they thought would lose coverage. I don't have another number in front of me.
Thank you, Mr. Chairman. I'll yield back my time.
Thanks, gentlemen, for yielding back. The chair now recognizes Congressman Allen from Georgia for 5 minutes.
Good, thank you, and I apologize for my voice. Many states, like my own state of Georgia, have been putting in place work requirements for work-capable adults on welfare programs. And I believe it's time for the federal government to follow suit. With 6 million open jobs in this country and more to come, every able-bodied American should have the dignity and opportunity to work. My greatest privilege in creating and growing businesses was the opportunity to give people dignity of a good job, the respect they deserve, and give them the opportunity to provide for their families and their church and their communities and, yes, this nation. By virtue of the chart we just looked at, what we're doing is not working. In fact, most people think that, in fact, I encourage businesses to go into the elementary schools and just open the eyes of these children, particularly in some of our very, very needed areas, to open their eyes to the opportunities that are available to them out here in this great country we live in. But for some reason they think that they're just going to be trapped in this same, the same process we've been working under. Mr. Meyer, obviously what we're doing is not working. So, and I do know that, or let me answer this question. If you're on government assistance and you don't know a way out, how are you going to get out? I mean, because you know, we have generation after generation. It's generational. And I mean, if they don't know a way out, how are they going to get out? And that's all we're doing here, I believe, is just saying, hey, there is a way. Can you address that?
Yes, sir. So the incentives has been the missing link. We have a robust set of career centers that offer services. What we have lacked is the incentive to get there. And what this does by engaging them in a community engagement requirement is it gives them the incentive to then connect with our career center and see all the different resources that are out there that are available to them. And I'll give you an example. We have a last dollar scholarship in Kentucky that will pay for, basically allow members to go for free to get a credential in a high demand sector, so that they're in a sector that will have a good job prospect. We allocated $16 million in our budget, and we've used 4 of that over the last budget. And so we have these untapped resources because we're not connecting them with the resources. They're not known. And so what this does by adding a community engagement requirement is gives them the incentive to connect with those resources and find out that they're out there.
Mr. Dorr, would you address that as well?
Well, to me, the key is employment. Most people only
knowledge.
What?
Knowledge of an opportunity.
Knowledge of an opportunity. People, it's not helpful to say that there are dead-end jobs or no good jobs, because in the way the system is set up, even a low-wage job can be leveraged with various forms of assistance to make someone's household income go well above the poverty line. That's a good thing. But when we have millions of Americans on programs who are work capable that aren't being encouraged to take advantage of that opportunity, we're sending the wrong message about how our system can work more successfully for them and their families. When I was the co-chair of the National Hunger Commission, bipartisan group, we met with SNAP recipients, and one of them said to me, this program is really good at getting me an EBT card, but it does nothing to get me a job. And that's what we need more of in these 2 programs.
Well, there are lots of good examples. In my district, some of my very personal great friends are great success stories. A lady now owns her own home. She's the supervising manager on the floor of a big tire operation. And she said, I've been on everything. And government assistance was the hardest thing to get off of because I had no idea what I could really do out there. So the testimonies are there. Mrs. Carter, any comments from you?
I think one of the benefits that we have in Utah of being under the umbrella of our workforce entity is that we not only provide opportunities for people to obtain employment, but also to increase wages and to scale up if they need to. And I think that's one of the benefits of integrating. Well,
we do not need to be an impediment giving people really the greatest right and God-given right that they deserve. Thank you very much, and I yield back.
I thank the gentleman for yielding back. The chair now recognizes the congressman from Connecticut, Mr. Courtney, for 5 minutes.
Thank you, Mr. Chairman, and to the witnesses for being here today. You know, in many respects, you know, how we as a nation come up with strategies to address workforce issues is really the question of the day. The last Department of Labor statistics showed about 5.8 million job openings in the U.S. economy right now, which is historically actually a very sizable number. But when I talk to employers, what they're saying is it's not a problem in terms of people coming in applying for jobs. The problem is there's a skills gap. Okay, so, and the committee's probably tired of hearing me talk about this, but I have a shipyard that is probably going to hire 1,000 people this year for the recapitalization of the submarine program. They've actually grown from 8,000 in 2008 and 2009 to 16,400 in the last about 8 or 9 years, and it's going to keep going higher. But these are metal trades, engineering, design work, and you can't just walk in off the sidewalk and fill these positions. So, you know, Ms. Carver, you talked about WIOA, which has been a very successful tool in terms of trying to get people into these positions. I would just note that the Trump administration cut WIOA's spending levels in its budget by 40% in terms of what they sent over this year. And again, the level that they cut from is still not even where we authorized WIOA when it was signed into law 3 or 4 years ago. A great bipartisan achievement, by the way, of this committee. And really, you know, forcing people to go to work, you know, by threatening their health coverage and, you know, food on the table is not going to change that skills gap. I mean, if we're going to really get serious about trying to give people, you know, the ability to have the dignity to support themselves and their families, we've got to give them the education and training to make that actually happen. And Ms. Hahn, I guess, you know, that would be sort of my question to you, is just, you know, if you know, we're looking at, again, an economy with this many job openings right now. I mean, at Hartford yesterday, Infosys announced they're coming into the state of Connecticut, big exciting day, 1,000 positions. These are people that need to be, you know, they need to be software, you know, fluent, and in the healthcare, we just had, all of us are having visits today from, you know, young medical students and nursing students to the AHEC program. The National Health Service Corps, they can't fill all the positions of applicants, of people who want to get those skills to make sure that, you know, we're going to have a healthcare system for the baby boomers. So again, Ms. Hahn, I was wondering if you could just sort of talk about that piece of this issue.
Right, and I think that is a big part of the challenge is the skills gap. And I think that the workforce development system, in theory, is really well placed to address that. But as you say, the funding is insufficient and is getting smaller. The funding is not sufficient now to support the people who are already seeking services. Most people who come to an American Job Center are getting just very basic. They're able to look online, do a job search, they're able to get some information. But in the most recent year for which there is data, nationwide, 153,000 adults received training, and 90,000 adults who exited from WIOA received training, which is far smaller than the need. And without the additional funding, it's going to be difficult to meet that need.
So again, just to talk about the shipyard, we had a welding program, which again, we had more people than we could enroll in it. 100% employment for people who completed the program. The federal funds from DOL ran out last month. And you know, the state's going to kind of scratch to sort of find ways to sort of keep this thing alive. They're looking at 1,000 this year and probably about another 3,000 over the next 2 years or so. And so I'm sorry, you know, no offense to you know, some of the folks who are, you know, advocating, in my opinion, these punitive measures to sort of force people to fill jobs that they can't because they don't have the skills and training. We're off target here. You know, this is the poorhouse, the poor laws approach, which is, you know, to punish the undeserving poor by taking away essentials for life, rather than focusing on things like raising the minimum wage and giving people the actual tools to survive and actually thrive in an economy that is looking for them. And but this proposal, you know, is just off target. With that, I yield back.
Gentleman yields back. The chair now recognizes the Congressman from Alabama, Mr. Byrne. 5 minutes for questions.
Thank you, Mr. Chairman. Mr. Doar, it's great to see you. I appreciate you being in Montgomery 2 weeks ago for the Faith in Politics Civil Rights Tour, the great meeting we have every year there. That was an extraordinary panel that you participated in as one of the children, adult children, of the great players in the civil rights movement in Alabama. Your father, John Doar, literally saved lives of people there. Congressman Lewis gave a great testimony about that. So I want to thank you for that. We had a great commemoration yesterday over in the Senate side of the 50th anniversary of Senator Kennedy's announcement that he was running for president. And I was reminded when I was sitting there listening to that, and you would have known a lot of the people in that room, that Senator Kennedy was very concerned that programs that we had to help people in poverty would actually trap them in poverty because it would make them dependent. So it was that spirit that I think that a lot of people from that generation had, that we're going to lift people out of poverty, not by giving them permanent programs, by giving them the way to move out. I also want to thank you for your great help to our bipartisan Opportunity Action Group here in the House. Congressman Byron and I very much appreciate all the work that you've done in help with us. We think we have a lot to learn from you and what you did when you were the commissioner of New York City's Human Resources Administration. You were able, because of your workforce development activities, to reduce the welfare caseload by 25%. Dr. Hahn made a very important point about the funding we have for workforce development programs. The problem is we have 44 federal workforce development programs across 9 departments and agencies. I was a former recipient of those funds as the Chancellor of Post-Secondary Education in Alabama. I know you got to deal with them. How can we do things better at the federal level so we can replicate across the country what you did in New York City? Would it help if we reduced the number of programs, reduced the number of departments and agencies, and made a much more efficient stream of revenue that came in to states and local efforts to bring people out of poverty?
From the local level, the complexity of the federal aid programs is very hard to comprehend and to deal with. And to the extent that funding streams could be merged and programs could be able to bring funding streams and use them in a more flexible way would be much more effective, including in building engagement requirements in SNAP and Medicaid that can be met by participating in training or education activities. Doesn't only have to be a job right away, that a 20-hour engagement requirement could be met by participating in a skills-based training program. But states can't do that as much as they could if they aren't given as much more flexibility to use these various funding sources.
I was talking to the man that now heads workforce development for the state of Alabama a couple of weeks ago, and I tried this idea out with him. I said, look, if we reduced all those complex programs into 2 streams of money, basically a WIOA plus stream and a Perkins CTE plus stream, and we took all of these requirements off of you, would you accept in return for that that you could lower the amount that you can take out of it for your admin costs, which means we get more money into the classrooms or whatever the job training was? And he said, absolutely, because I wouldn't need that much admin cost to meet the complexity of the programs you're throwing at me. If you give me very efficient streams without all these red tape requirements, I can get more money out there that actually does perform the services that Dr. Hahn has said that they need to get directly, and I know you have actually been able to do. Do you see that as a good trade-off too?
I definitely see a trade-off in greater flexibility and being able to merge funding streams. That's a positive thing. I should say that I do think the federal government, in giving this money, should also take a strong stand on the importance of an engagement or work requirement within programs for work-capable adults who report no earnings when they apply. And I do that not because I want to save money or because I want to impose my values. It's because I think those households will be much better off if they're helped on the path to employment and not ignored.
Well, I think one of the things that's true about human beings is that someone has to hold us accountable for everything. We have to hold you accountable for the money we send you from the federal government, but the people that receive this money directly in either the form of welfare or indirectly through our work training programs, we have to hold them accountable too. Accountability is good for human beings. It's not being punitive. It's actually helping them lift themselves up. It's actually giving them the sort of intrinsic value to their life that only work and taking care of yourself can give. So I thank you for your work. I thank you for all that you've done to help us, and come back to Alabama. With that, I yield back.
Thank you, Congressman. Thank you.
Thank you. I'd like to now recognize the representative from California, Mr. DeSagne, for 5 minutes.
I just, first of all, like to associate myself with at least the spirit of my friend from Alabama, someone who's been accused of sounding like a Republican by the chair of this committee when it comes to my experience with workforce investment boards. Just getting the lower performing boards to come up to the higher performing boards, I think, is a commonality that would help everyone. I frequently go and have visited my mom's nursing home in San Francisco, where the minimum wage is almost double the national average, and talk to her wonderful caregivers and hear how they struggle. And I'm reminded constantly when I talk to those, engage with those folks, the research from Richard, Florida, that his opinion is, and seems fairly well documented, that if you worked a full-time minimum wage during the Eisenhower administration, your household income was equal to 55% of the mean household income nationally. And it strikes me that's part of the problem, is that minimum wage has not been been indexed for inflation, obviously, but purchasing power and the cost of living clearly has been impactful for people at minimum wage. And for healthcare workers, for a growing population that's going to need them, it seems like there's a real urgency to address that. First, to Dr. Hahn, we've had so much progress, and after maybe Mr. Doerr, the convergence of agreement on evidence-based research when it comes to our criminal justice system, and it strikes me that this is not far afield from that. So in a changing workforce, it seems as if the application of evidence-based research is an opportunity, much like criminal justice, which still hasn't seen the fruits of that initiative, and our ranking member certainly knows that in his individual commitment to this, but it seems like there's an opportunity for us to cross ideological paths to apply policy that evidence-based research would tell us is effective in giving opportunity. So if you could address that, Dr. Hahn, and then in the Bay Area, I'm engaged with a number of initiatives with high-tech companies, and the most clear example to me is with the Teamsters and Uber and Waymo, where if we know that automated trucks are coming, let's engage now about what happens to that workforce. So we work with the Teamsters, we're working with UPS, a lot of trucking companies. So it's the evidence-based research, and then in a transforming workforce with demands, why wait when we can see this technology coming and try to adapt to it more quickly with employers and employee groups? So could you talk a little bit about that, particularly the evidence-based research?
Yeah, so as a researcher, of course, I think evidence is very important when we are making policy choices and when the committee is considering policy choices to consider the evidence. We also need to be building more evidence. And as we are trying things and states are having waivers and demonstration projects, those need to be rigorously evaluated. And not only checking to see if the outcomes that we expect happen, but also looking for those unintended negative consequences. For example, not just seeing how many people are able to get jobs, but are there people who lose assistance because of red tape, for example. So both the intended consequences and the unintended negative consequences are very important for us to really understand better.
Mr. Doerr, maybe you could talk to the evidence-based research and at least the hopeful convergence here with what we've learned in criminal justice and you have been engaged with. In the second part, I just want to ask you this question. Having labored through Thomas Piketty's book, I always wanted to ask someone from your perspective, the historical inevitability of his formula that seems pretty hard to argue against, that as long as rate of return on capital investment is outgrowing growth, that this inequality is inevitable. So first on the evidence-based research.
I'm a big supporter of evidence-based. I think was important research done in the preliminaries to the welfare reform that showed that Work First worked more successfully than exclusively training and education in raising incomes and getting people into employment rapidly. That's why I think we applied it, and I think it proved to be correct. I also think there's a lot of evidence-based on enormous reductions in the application process and documentation requirements that have made the so-called red tape aspects of applying for Medicaid much, much less. As a former bureaucrat who did that, I'd like to just defend participation rates in SNAP and Medicaid are off the charts because we've reduced those burdens. I think maybe too much because we're not talking to people about helping them get into work. And with regard to the inequality issue, I've spent my career working for people who are the most needy and the most struggling. And I've tended to focus on how I can help them get up to the first and second ladder and out of poverty so they can support their family. That's why I support work supports to make work pay. And I think for someone who does that sort of work, I just have not had time to think about the gap between what's right in front of me and people who I see and talk to. It seemed to me they were concerned about their family's livelihood and getting up to a standard that was acceptable and appropriate for them and their families. They didn't really focus on what was happening in the rest of the American economy.
You should attempt to read the book. It's laborious, but it was worth it. Thank you, Mr. Chairman.
Thank you. The gentleman yields back, and the chair now recognizes Congressman Smucker for 5 minutes for questions.
Thank you, Mr. Chairman. Great hearing, great discussion here this morning. A few years ago in my district, in the city of Lancaster, we created, or the mayor there, Democrat mayor actually created a Lancaster Poverty Commission. We had looked at some of the great things that were happening in terms of revitalization of the city, but then saw that it really wasn't impacting the poverty rates in the city. So created a commission of members of the community who looked at the problem and set a goal of reducing poverty by half in the city and by 2032, and are making some great strides. They ended up, after a lot of discussion, entitling the report they did "One Good Job." And in fact, their top measure for whether they'll be successful or not, the top indicator is living wage employment. How many folks were they able to take off some of the programs that they're dependent on and move them to an employment where they can support their family and have the self-worth of a job? And it's all of the strategies are revolve around that, which I agree with. I think being able to provide that job, the self-worth that comes with this, is really the ultimate solution for those who can do it, for those who can work. So, and I agree with some of the comments that were made today in regards to the skills gap. There is a skills gap, and what this group has learned, and what you all know, what some of you have said here today, is we have to take a holistic approach, and they're complicated issues for every single individual who finds themselves as dependent on these programs that need to be addressed to move them to a good paying job. So it's hard work. But I think the skills gap and the job market today really does provide us an opportunity to make a difference on poverty in a way that we haven't been able to do. And so I think this is a great discussion, and I look forward to working to find solutions. I don't understand the opposition to job requirements. I think we all believe that there should be some effort on the part of recipients, of beneficiaries, to move to the workforce if they can do so. Again, this is only, we've all said, everyone, different opinions here, but you've all said that there's a group of individuals who can move to the workforce. So we should expect that they do that. And sometimes it's maybe not a living wage initially, but at least they're moving up that ladder, even if it's volunteering somewhere to move into the system rather than just be trapped in it. So one of the things, and Mr. Meyer, I want to just ask you a question. One of the things that we've learned in my community in Lancaster is that a lot of the programs, a lot of the agencies that are working, and these are agencies that are supported by the government, these are nonprofits, these are some that are entirely private agencies supported by contributions, but they're all working together, and they found, as they all came together, that it wasn't very streamlined. The system itself is not streamlined. A beneficiary can go to one place, you have to provide lots of information, they go to the next agency, and they have to do that all over again. There's no, different organizations have different skill sets in terms of what they provide. And so they are actually working on a system, it's actually a software system that would provide the kind of streamlining that they think is necessary. And I'm curious what your thoughts are on that. Where do you feel that we can streamline programs? Where can we improve communications across programs?
So I think it's twofold, and you touched on both of them. One is technology, and that's one of the things that we focused on as we've implemented our waiver. We focused on building a case management system that could be used across the state for all of our WIOA career centers. They can go in there, they'll be able to do the assessments and go through all the normal case management functions. But the other thing that it does is it links with our integrated eligibility system. And so there's one single sign-on for the members. They can go to either system. The information flows back and forth. So there's one point of access for the members. They'll also be able to do their My Rewards activities, do training such as health and financial literacy for those classes. They'll be able to track their rewards, enter their community engagement hours. It's all mobile friendly. 80% of our members have smartphones. So using technology in a way that can integrate those functions is one thing. And then the other, of course, is better alignment at the federal level of these policies that create silos and being able to break those down in a way that, that's consistent across the board.
I'm already out of time. I had another question I wanted to ask, but look forward to continuing this discussion, and thank you for being part of this today.
The gentleman yields back, and the chair now recognizes Congressman Takano. 5 minutes for questions.
So this is a very obvious question, I know, but I think let's try to clarify things by asking it. Dr. Hahn, in your read of the rigorous evidence that exists, do work requirements move people out of poverty and into economic independence?
No. We have seen from the experience with when TANF was first implemented that there was some short-term increase, modest increase in employment that did not last. People did not generally achieve steady employment, and those who did find employment were not lifted out of poverty. And we have recent evidence from Kansas that also found that the people who left TANF were not better off. And we also know that sanctions is an important part of this. People who are sanctioned off of work requirements, sanctioned off of assistance because of work requirements, have the worst outcomes.
Yeah, so it's more complicated than just an easy soundbite addressing people who may be ostensibly able-bodied, but can't, but trying to get sustainable participation in the workforce. Sustainable participation in the workforce is, I think, the issue. So SNAP and Medicaid data show that most participating adults not receiving disability benefits are either working or between jobs. That is, they have worked steadily, they have worked recently, and will soon find a job. Among those who are not working, a large share of those people have health issues or are caring for family members who are sick or who have a disability. And that comports with what my own Medicaid, the people in Riverside County, the Inland Empire Health Plan, they tell me that most of our Medi-Cal folks are working, or if they're not working, they tend to be disabled or caring for people who are disabled. We know from experience that in TANF and in SNAP that many families facing these challenges lose assistance due to work requirements and time limits because complicated exemptions are hard for recipients to understand or apply for, or hard for states to get right. Can you talk about what can happen when a household that has very low or no income sees their SNAP benefits cut or eliminated and adults lose Medicaid? What are the long-term consequences for the kids in that household?
Well, we know what happens, what the positive consequences are for those children of receiving Medicaid and SNAP. So we know what positive consequences we are foregoing by not giving them the support that they need to develop to their full potential. So, for example, when Medicaid and CHIP are expanded in the 1980s and 90s, following those children who had access to the expansion of Medicaid, when they reached age 28, they were paying more in cumulative taxes, they collected less in EITC payments, and they had higher wages than children who did not have access to Medicaid. So we are really shooting ourselves in the foot by not helping children access and their parents access the food that they need and the health care that they need.
Well, we can often posit what sounds like common sense solutions. So work first kind of people, yeah, work first. That might work, but I was listening to the director of my own Inland Empire Health Program talk about, shouldn't we think about health first? That you can't work unless your body is healthy. You can't work unless your mental health is in a good place. And that the stress upon low-income folks is high, and we had many, many low-income people in the last recession. And the tremendous pressure it puts on people's spirit. We can call it mental health or their spirit. But that if we can address the well-being of people and not subject that to a kind of test. If you don't have those things first, how is it that you're going to be able to have the motivation to seek work and to be able to be employed and attend and show up to work all the time if you are in either mental distress or your body is not fully well? So that's my thought.
The research shows that SNAP and Medicaid help people maintain their health and their well-being for themselves and their children so they can stay in jobs and their children have long-term positive outcomes.
Thank you, Mr. Chairman. I yield back.
Thank you. The gentleman yields back. The chair now recognizes Congressman Grossman from Wisconsin. 5 minutes for questions.
Thank you very much. Obviously, many of these programs took off in the 60s, really began to explode. And I'm always struck by, the writings of Karl Marx or Antonio Gramsci, who felt the key to taking over our Western civilization was the destruction of the American family. And I think they finally got their really dream in what happened in the 60s. And I always feel it's unfortunate when people focus on dollars rather than the human impact that these programs have. But I'd like to ask Mr. Doerr maybe to comment on the effect on the American family, the ability of children to have their parents at home with them, the effect these programs have on that.
Well, there's a lot of evidence that, and that's accepted in a bipartisan way. We did a working group with both Brookings scholars and AEI scholars that emphatically stated that children do better off, as a rule, on average, when they are raised in two-parent married families. And that we ought to be honest about that when we communicate to young people.
Yeah, that's obvious, but do you think there's obviously been a huge devastation in the American family since Lyndon Johnson kind of began all these programs, almost all of which seem to be targeted at punishing?
There are a lot of factors that have contributed to the growth in single-parent households in the United States. I think some of them are related to our safety net programs, but there are others as well. There are cultural changes, there are other issues. So it's hard for me to say that the entire blame for the fact that now 40% of American children are raised with a single parent is due to the safety net system in the United States. I think that would be putting too much blame on that.
You don't see a correlation between the dramatic jump up in that in the 60s and the Great Society?
I think that there is a correlation, but that doesn't necessarily mean there's a causation. And so that's my view of it. Do I think that it's an issue we should talk about and stress? Yes. Do I think households should be encouraged to go to work? Do I? Absolutely. But I'm not so sure that the entire fault should be blamed.
Well, we didn't say the entire fault, but it's kind of a huge thing. I mean, I think unless you hang around in a very stratified world, you talk to people who will tell you their children are not getting married or whatever because
there are marriage penalties in the various programs so that if people marry, they lose a portion of their benefits, and that's something we should
lose all their benefits, right?
We should do more about. Yes, they can often use all of their benefits.
Can you lose $30,000 a year sometimes by getting married?
We should absolutely do something about that.
Okay.
But I also think that, by the way, that work requirements combined with work supports and a strong economy did lead to higher earnings, more work, and less poverty in the late 90s and 2000, and still would lead to those things. So I think it's work and family both that we need to talk about.
And anybody else on the panel? Did we get anybody else when we looked for the panel today who would comment on the, kind of the dream that some hard left-wingers have of such a destruction of the family, and then it kind of began to happen with a big increase in these programs? Nobody on the panel? Okay, I'll give you another question. People feel that everything is tight as a drum here. Wherever I go, they sell food stamps 50 cents on the dollar when I talk to people. Does anybody care why? I mean, if things are really tight, you'd be selling food stamps for like 95 cents on the dollar. But the fact that people are selling their food stamps by 50 cents on the dollar everywhere you look, does anybody want to comment on that?
Well, I was the SNAP administrator in New York City, and I ran the program in New York State as well. And I always felt that we were not given enough authority to look into what we could see right in front of us when it came to fraudulent trading of SNAP cards or of inappropriate behavior by vendors who are cashing out SNAP benefits in a way that they shouldn't. The federal government holds that very closely to themselves, and they shouldn't, because it leads to diminishing the
I'm going to jump in because I
program.
run out of time. Do any of you, I guess you're from all over different places of the country, is there any one of you live in an area in which food SNAP benefits are not being sold for 50 cents on the dollar?
So
when you get out and talk to people?
In Kentucky, there's been issues, and they tend to sell them for soft drinks, and then they take the soft drinks back to a convenience store, and they sell the soft drinks back to the convenience store cheaper than they can buy it from a distributor.
Well, don't. Okay. Usually, I find when I get around my district and I talk to people who are living in, you know, the type of class where you're getting a lot of SNAP, and usually they sell them for 50 cents on the dollar. Does anyone around here live in a district in which they're going for more than 50 cents on a dollar? Apparently not. Okay, thanks.
Gentleman's time has expired. I now recognize the ranking member, Mr. Scott. 5 minutes for questions.
Thank you, Mr. Chairman. Mr. Meyer, according to the Courier Journal, the new program under your waiver with the job requirements will require you to spend in the next 2 years $374 million. Is that right?
That's what that was a budget estimate that was taken out and reported that included both our Medicaid enterprise management system as well as our Medicaid implementation costs. So we have no official estimate at this point as to what the overall cost will be for any implementation cost.
But that's what you put that in the budget for this year and next year, a total of $374 million additional dollars. Is that right?
We have earmarked $17 million in the budget for the implementation cost of the waiver for this budget.
What's the rest of the $374 million for?
You know, that I'm not sure about. I do know that, I mean, that's the state share of the $17 million, so some of that would be federal share. And again, that's more of a ceiling, an earmark, and that also includes a very expensive MMIS project as well.
And after you spend the money, did you estimate that according to the newspaper, 100,000 fewer people would be covered?
No, so what that actually represents is 100,000 fewer people will be enrolled in the Medicaid program at the end of 5 years, which would include people who, because of the program policies and focus on work, would move out of eligibility of Medicaid and into private sector coverage.
So you'd be covering 100,000 fewer people under the program?
Under the Medicaid program, yes, but it's not that they would not be covered.
How is this additional cost going to be paid?
So most of the implementation costs are being paid for out of the savings from our move to healthcare.gov and shutting down the state healthcare exchange. So we're saving about $15 to $20 million a year by making that switch, and we're being able to pay the state share based on those savings for the bulk of the implementation cost.
And is the federal government, is this the Medicaid expansion where the federal government is paying 90% of the costs?
For the bulk of the population that is in our waiver, the federal government is paying 90% of the cost, or whatever the enhanced match is at the current time.
We held a hearing in this committee recently on daycare, and the consensus was that work requirements just don't work unless you have affordable daycare. Do you agree with that?
Daycare and other supports are critical pieces, critical supports, and that's why in our program we've built a link in our IT solution that allows them in the Career Center to build a referral for eligibility for child care for those who are working.
And that affordable child care is not attainable unless it's subsidized. Do you agree with that?
I think that depends on the individual circumstances of every case.
Well, if you're talking about somebody who's on Medicaid and infant care is more expensive in most states than four-year college per infant, a lot of people just aren't going to be able to afford it unless it's subsidized. Isn't that right?
Again, it would depend on the circumstances. So, for example, in our community engagement requirement, you are exempt if you're a primary caretaker. And so you would not have to comply with the community engagement requirement. And there's multiple people in a household in SNAP. So in SNAP, none of the people who are enrolled in the program, if they have a child in the household or a dependent in the household, are required to work. So again, it would require a look at each individual member's circumstances.
Who would be paying the extra cost for child care?
So we have a child care assistance program. It's a federally funded program that the state, I think, matches, and that's administered in our eligibility system, our integrated eligibility system that they enroll in for Medicaid, SNAP, TANF. Child care is included in that, as well as we built that, again, we built the link in from our case management system for the...
Who's going to pay the additional cost for child care?
I'm not sure there'd be an additional cost, again, if you're...
You're not going to provide any additional cost for child care, and you're going to have a work requirement.
Again, if you're in the community engagement or work requirement, you are exempt if you have a child that's a dependent.
Mr. Chair, I ask unanimous consent to enter into the record a letter written to the Secretary of Health and Human Services, signed by over 170 members of Congress, raising serious questions as to the legality of the waiver insofar as the provision violates the letter and spirit of the Medicaid law.
Without objection, so ordered.
Time has expired. Thank you.
The gentleman yields back. Seeing no other members seeking recognition to ask questions, I would like to again thank our witnesses for taking the time to testify before the subcommittee. I now recognize Ranking Member Davis for any closing remarks she may have. Ms. Davis.
Thank you, Mr. Chairman. I think we have had a good discussion. I think there's still not as much clarity as we all would like. I do think that there is some consensus in terms of having alignment is a good idea. The difficulty is that it often means that within different areas there are some cutbacks in order to fund other things. And so we end up perhaps not having the resources that would be required to actually do something in a comprehensive way, in a holistic way. It's clear that there are exceptions, and there should be exceptions. If 60% of people on TANF tend to be women and children and seniors, those who are not able to work, then we clearly have to make accommodations for them and look closely at the people who are being helped and who would not be able to be working in some of those other settings. So I thank you all for being here. I wish we could come up with something that really would be funding appropriately, that would provide the kind of services and would have the kind of ability over time to see what the outcomes are. We have some studies, but clearly there are differences and people tend to interpret information differently. So, we want to continue to open up this question, get the facts, and truly provide the kinds of programs that make a difference to people. Thank you.
Thank you. This has been a very informative hearing, and I really appreciate the opportunity to be here and appreciate Mr. Meyer coming to testify on behalf of the program we have. I know the governor and I see a lot of the same folks back home and go to typically every time you walk into a business, they're looking for employees, they're looking for people to hire, looking for people to work. Our workforce investment boards, I'm not saying they never ask for more money, but their number one issue is for people to train. I mean, they say we got all these programs, they're setting it up, we're trying to find the people to show up. And so the group of people that the governor and the legislature are dealing with are people that are wanted. There are people that are needed. There are people that I will tell you employers are really, really wanting to see in their workforce. And so that's what we're trying to match up. And I hopefully people have seen that the Kentucky program wasn't. I think there was a quote from one of the witnesses said, we can't just say you're required to go to work. That's not what they're doing. They're finding able-bodied, so it doesn't have dependent children. My understanding, correct me if I'm wrong, and a wraparound services to get them into these workforce investment boards so they do have a better future and a better life. So I think it's well thought out. And I look forward to the research to see how well it's executed and implemented. And I have confidence knowing our governor that's going to be well executed, or the people will be working hard to do it. But I do think it's something subject we'd be open to study and see how the people who do this kind of research move forward, and I have every confidence it will be successful, and look forward to moving forward. And it has been informative, and all 4 witnesses really appreciate it. And seeing no other business before the committee, without objection, the committee stands adjourned.